that, I believe that we can get started. Hello, everybody, and welcome to the World Health Organization and International Diabetes Federation World Diabetes Day webinar. Our title of our webinar this year is Breaking Barriers and Bridging Gaps, Uniting to Strengthen Diabetes Well-Being. Now, I'm happy to share that French and Spanish interpretation are going to be available for this year's webinar. If you'd like to access our interpretation services, please click the interpretation button at the bottom of your screen. And if you don't see it there, you might need to click the More button and then select Interpretation. Now, hello everybody, my name is Aurea James and I am so excited to be one of your moderators for today. I am a consultant with the World Health Organization Global Diabetes Compact, and my role specializes in advocacy as well as communications. I have been so privileged this year to help lead some of the World Diabetes Day initiatives, including this webinar. Now, I've been living with type 1 diabetes for 15 years of my life, and I can't think of a more meaningful way of spending my 15th Diabetes Awareness Month than by being here with you and by encouraging conversation related to our theme of diabetes and well-being. A lot of the topics that we're going to be exploring today, like diabetes stigma, diabetes misinformation, and mental health, are quite close to me. And I'm really grateful for the opportunity to help lift these important topics onto a global stage. Now, we have an incredible number of us in the room so far. It looks like we have about 500, almost 600 participants so far. Thank you to all of you individually for taking a bit of time out of your day to come join us for this webinar. We have a really wonderful series of speakers lining up, and I encourage you, as we move through our webinar today, please do try to approach everything you hear with both kindness as well as curiosity. And with that, I think my introduction is done, and Phil, over to you.
Thank you, Aurea, thank you, and welcome everyone, whatever time of day it is for you, wherever you may be. My name is Phil Riley. I'm a director with the International Diabetes Federation. I have been living with diabetes for more than 30 years. I have a background in public relations, marketing, and association management. We're all here today on the eve of World Diabetes Day to mark the occasion. The date, 14th of November, as we all know, was selected by the International Diabetes Federation and WHO as the date for the first World Diabetes Day back in 1991, a date chosen to mark 100 years then that had passed since the birthday of Sir Frederick Banting in 1891. Banting is, of course, widely acknowledged for his role in the discovery of therapeutic insulin. The day is an important day in the calendar for diabetes awareness, but it's also a day to celebrate the lives of people living with diabetes and their family, their friends, and the healthcare professionals who support their care, as well as the scientific researchers working to advance care and prevention. The campaign theme for this and coming years is highlighted in our campaign video, which we will share with you now. Thank you. Small technical glitch while we wait for the video to play.
Diabetes is ever present, even if we don't want it to be.
Diabetes is a 24/7 condition for the rest of our lives.
Not just your hobbies, but also your work life. Absolutely everything is impacted by diabetes.
You need to always stay on guard. You always have to make extra decisions.
In the morning, in the afternoon, in the evening.
Everything that I do is informed by how much I'm trying to manage my blood sugars.
There's 5% or 10% of my brain that is dedicated to diabetes 24/7, 365, and it'll continue to be until I die. If I'm going out, I'm okay to forget my house keys, but I would not forget my pouch that has my insulin and the essentials that I need.
The most difficult thing about living with the diabetes is uncertainty.
Stigma and discrimination.
Accepting that it will limit you somehow. There are limits you don't choose. You cannot avoid them. I've always said that diabetes doesn't define me. It doesn't say who I am, but it has certainly shaped the person I am today.
Living with diabetes for the last 27 years, people thought that I'm strong. But actually, I'm not that strong.
As good as you can be and as good as you are with your management, there are some unknowns.
I'm not a superhero. I mean, I can also feel burnout and feeling tired of surviving with diabetes.
There are many moments when diabetes can be really overwhelming. It's ever present. It doesn't let you think straight. It doesn't let you function properly. It is very demoralizing.
I have seen a lot of patients who get to a point of their life when they get sick and tired of taking their medicines.
Sometimes the healthcare team cannot help you. There's not access to mental health resources as easily as the physical health resources.
Mental well-being is not something that most doctors are concerned about.
I'm not satisfied with the kind of support that I'm getting. I think there is need for more.
Adding the psychological assessment on day one and also a yearly review on how we run through our life with diabetes journey.
Because diabetes causes a lot of distress and a lot of fatigue that has an effect on people's well-being.
A lot of doctors here do not talk about doing exercise. They don't prescribe exercise as medicine and tell people with diabetes how to do the exercise. They don't do diabetes education that is so much important.
Community is an integral part of well-being, and it would be amazing for the healthcare system to mirror this. It's the sharing that makes it easier.
Knowing that I have a safe space to talk about what I'm going through.
Living with diabetes should not be a hindrance to what you want to do in life. It should not take away your dreams and your passion for life.
No one wants it, we could do away with it. But we can also turn diabetes into a magnificent journey.
When someone with diabetes comes to the consultations, if we see that person as a person, not as a patient, we are seeing a human being. And that human being could also be my son, my mother, my brother. So we will treat them differently. If we do that with every patient, the world can change.
And, sorry, BG is okay, it's telling me it's okay.
Thank you very much to the International Diabetes Federation for sharing that video. I thought I would quickly take us through our webinar agenda before we get the ball rolling. We're going to continue on with a couple more opening remarks before we move on to our first lived experience speaker. Following that presentation, we're going to be trying a Kahoot. Now, a Kahoot is an online platform where you can take gamified versions of multiple choice quizzes, and this is going to be the platform we're going to use to learn more about you, our audience. Following that Kahoot session, we are going to move on to spotlight sessions from both the International Diabetes Federation, in addition to the World Health Organization Global Diabetes Compact, before we move on to our second Kahoot. After that second Kahoot, we will be having a panel discussion, and we're going to be joined by 4 incredible panelists, all from different regions of the world, all with different lived experiences of diabetes. And following that, there will be closing remarks. Now, before we get started, I thought that I would give you just a little sneak peek at what exactly the World Health Organization Global Diabetes Compact is. I myself was not familiar with the GDC before joining. And so to all of you on the call, the Global Diabetes Compact is a World Health Organization initiative, and we have a vision. And that vision is to both reduce the risk of living with diabetes, and then also to ensure that everyone who is diagnosed with diabetes has access to equitable, comprehensive, affordable, and quality treatment and care. Now, the work that we do here helps to inform broader World Health Organization efforts towards the achievement of the global diabetes coverage targets, which you will be learning about a little bit further on in this webinar. And these targets were endorsed back in 2022 at the 75th World Health Assembly.
Thank you, Aurea. A little short introduction to the International Diabetes Federation. Since we were first created in 1950, we have been uniting the global diabetes community in response to the ever-growing numbers living with diabetes and the need for improved care and prevention. Our vision is that all people with diabetes have access to affordable, quality diabetes care and education, regardless of where they live. Our mission is to improve the lives of people living with diabetes and prevent diabetes in those at risk. Our organization unites more than 240 diabetes representative organizations in over 160 countries. Today, I carry an apology from our president, Professor Peter Schwartz, who cannot be with us in person as he is in India to promote action to improve care. He has shared a video with us, and we can go to that video now. Thank you.
Dear colleagues and friends, it's a great honor for me to talk here to welcome all the participants to the joint International Diabetes Federation and World Health Organization webinar to mark this year's World Diabetes Day in 2024. I would like to thank all the colleagues from the WHO for the opportunity and the introduction, and I'm delighted to welcome all the attendees to this session. Myself, I'm Peter Schwartz. I'm Professor for Prevention and Care of Diabetes, and I'm the President of the International Diabetes Federation. And it's of great importance to me to highlight the theme of this year's World Diabetes Day, and it is diabetes and well-being. There are millions of people living with diabetes, and diabetes itself as a disease is affecting quality of life and well-being of people living with diabetes in the workplaces, at home, in the peer environment, at school, and often they experience stigmatization. The demand of self-care for people living with diabetes on a daily basis, every day, every morning, every evening, throughout the day, puts an additional burden on people living with diabetes, and this has an impact on well-being. And we as healthcare professionals and carers often only focus on pharmacotherapy and glucose and biomarkers, and this is wrong. We have to change. We have to put our attention onto the needs of people living with diabetes, onto the well-being and the quality of life of people living with diabetes. And the International Diabetes Federation, it is a passion and a momentum for us to make a difference for people living with diabetes. We have surveyed into this field, and it turns out that 3 out of 4 people living with diabetes already have experienced stigma and impact on well-being, impact on quality of life due to diabetes. 79% of people living with diabetes already experienced burnout due to diabetes, and this is twice as bad because the burnout due to diabetes, it's bad itself, but it negatively affects again self-management and self-care of people living with diabetes. And 75% of the people would like to get help and support, social support, peer support in terms of well-being due to, or the impact on well-being due to diabetes. But often they fear to ask for this. And this is our task. We have to change this. We must change this. We should become the frontier in highlighting this point and improving quality of life and well-being of people living with diabetes. So please see this as a call to action to talk to policy makers, to send online letters, to send letters to national policy makers, and to highlight and ask your policymaker to accelerate the implementation of the World Health Organization Global Diabetes Compact, because this would be the step forward improving quality of life and well-being of people living with diabetes. I would like to thank you for your passion, for your enthusiasm, for your energy, not only to talk, but to walk together with the International Diabetes Federation and WHO to make a difference to well-being of people living with diabetes. Thank you very much.
Thank you, Peter, for those kind words and your warm welcome. We're now going to turn to our first speaker. If I could have the next slide, please. Thank you. Our next speaker is a member of our Blue Circle Voices Network, Osiankwai, from Nigeria. She is an absolute lion or lioness in diabetes advocacy, and I pass the word to you. Thank you.
Thank you very much. Thank you for the introduction, Phil. My life with diabetes has been a very interesting one. I came from a family where my parents both lived with diabetes and passed on with diabetes. And my mom had a complication. She had an amputation, which traumatized me as a young bride then. I never knew about gestational diabetes. So when my mom died, it broke my heart because she was planning my wedding with me. And when she passed on, I told myself that I was going to make a difference, not knowing I was going to have my own story to tell later in life. So my first child, second child, I had gestational, and that's how my life changed. Now, I never heard of gestational diabetes all my life. I never knew diabetes can affect a younger person. So there was that misconception that diabetes only affect the old, the elderly, not the young. So much less talking about type 1. So going down memory now, I can now see that some people that lived, young people who lived among us actually had type 1 because of misconception and misinformation, perhaps stigma. They died from it, or they never spoke about it. Because I can recollect some people who I knew were fat, very plump, who became very slim. And I can remember now they're living with diabetes, that means they had type 1. So my journey changed my world, and I became an advocate because I wanted to be different. I didn't want stigma to continue to be. I became the face of diabetes advocacy, gestational mother. I started gestational pregnancy. So I had that history. Can you hear me?
We lost you for just a second there. We lost just a few seconds, I'm afraid.
Okay. So, but I journeyed down and had my beautiful daughters, was not diagnosed with type 2. But the wonderful thing that happened was I had a very understanding care team who educated me, empowered me, enabled me to be an advocate. And I had a wonderful family who supported me. Yes, the community, my environment didn't understand diabetes, but because I wore that smile and that advocacy and that picture of being a face of diabetes, my community embraced me and people started listening. I changed the negative narrative about diabetes by being the face of diabetes. Everywhere I go, I change the meal of my family. We eat healthy. But I'm super grateful to God that I live with diabetes because everybody around me is healthy because they now eat healthy.
I'm afraid we've just lost you again, if you can hear me.
Can you hear me? I don't know that you're hearing me.
I hear you again now. We lost you for just a short while.
Wow. I guess my network is not acting now. Is it okay now?
We're hearing you perfectly now.
Oh, I'm sorry about that. Sorry about that. So I wanted to correct the misconception and I wanted to stop the stigma, I decided to be the face and talk about it morning, afternoon. And if you from the picture you can see where I support my children when as a young couple. You can see where my husband, my children, as a lion, we go around the community advocates and talking about diabetes. And when it comes to self-care, I don't joke with my health. And I was lucky I met some great volunteers who came from the US, some podiatrists who came from the US. You can see where they helped to take care of my nail. But my mother died of uh, complication due to the limb. She was amputated. I had that fear in me. But when I met the podiatrics, the fear died down. So I talk really about, I now set up my NGO, Diabetes Limb Salvage Foundation, creating awareness that you take care of your feet, take care of your health, take care of your feet, know your status. You can prevent complication of diabetes. You can also prevent diabetes. You can see some of my friends here, the two ladies with me down there. One of them is living with diabetes. I never knew. It was just last year she opened up to me because she saw that I'm open and I'm living healthy. So she opened up to me and said, look, I'm living with this condition. What do I do? So I have become a source of strength and support to them. And if you look down the sixth picture, that's the EMSO, the endocrinologists of Nigeria, where they are having their meeting. I've taken my voice there to be with them, but you can't do it alone. They can't do it alone without us supporting them. And they welcomed me. So I'm working with them working with us to have a harmonious approach, nothing about us without us, about diabetes. And I did not stop there. I also take the voice to a national level. You can see me with the WHO rep in Nigeria. We met at the NCD launch in Nigeria, the first time they launched a document about Nigeria NCD. I was there with my team, and the WHO representative also welcomed us, and I told them inclusion is key. You need to include us in everything about diabetes or non-communicable. My beautiful daughter you are seeing there with a cake in front of her, she just turned 18. That's my daughter that I had first with as a diagnosed mom. You can see what's on her table is healthy made food, fruits. You need to make your family be part of all your journey. You can see my daughter also, they join to support me when I go for medical screening. So my family eats healthy. Everyone in my home, every friend that is around me, everybody is eating healthy because I made myself face of diabetes. And I talk about it freely. You can see my other 3 children who support me. I go on medical screening in my community. They all come out to support me to do that. So that picture where you see myself and my 3 other daughters supporting me, it gives me strength. So when we do this teamwork, it helps to drive down stigma. But you can see the topic we are preaching today, diabetes and well-being. My burnout when it comes up, when it comes up, my family is there to support me. There are times when, like for about 3 months before now, I was having high figures of my glucose was getting high for no reason. I exercise, I eat right, I take the right insulin. My doctor was confused. So the extent I was placed on Ozempic, maybe that's the solution. And Ozempic is expensive in Nigeria. I looked at it, I said, I don't know what to do. I was angry, I was upset, I stopped exercising. That's the burnout that can come up. But at some point, I met my doctor friend and my husband, my children. I told them my concern that I'm worried, I'm scared. And thank God for the support team I have. They were able to go with me through the journey and say, look, just relax. Take a deep breath. You've been doing well all these years. These high figures happening in a few months, it's not going to eat you up. You're going to overcome this. And I did. Here I am today, talking, my sugar is under control. So when those burnout come up, you need team, you need your support group. So I will say that everybody out there, have your tribe, have a team. Support group is important. You should include your exercise partner, if somebody to exercise with you, to eat right, and to stand tall. I stand tall anytime. I am not ashamed. I'm not ashamed to say I'm living with diabetes morning, afternoon. I'm not ashamed to talk about. I just came back from a walk, from a diabetes blue circle walk to mark the World Diabetes Day. Yesterday, I was in the secondary school to talk about diabetes prevention, exercise, healthy indeed to students.
Well, Sarah and Poe, I just want to know that you've reached the 10 minutes mark.
Okay, so I cannot summarize everything in just 10 minutes, but I will tell you that well-being is important to us, and as a team, we can do a lot more. Thank you.
Thank you very much. That's a powerful testimony. It's really coming through the need for that support network and the sort of virtuous circle, if you like, where your family is supporting you to conquer your diabetes and you're supporting your family to live a healthier life. And I thank you for all the work you're doing in advocacy. Thank you.
Yes, thank you so much. I just want to highlight two of the things that you said. I heard you say nothing about us without us. And I also heard you say you need to find your team. And I think that those are two sentiments that I agree with and would love to share widely. Diabetes is a family affair. It's a community affair. And the more that we find our team and find our support circles, I believe the better that we have the ability to manage our diabetes and maintain our diabetes well-being. I am now going to be moving us on to our very first Kahoot session of this webinar. And as I explained previously, Kahoot is like an online gaming platform where you can take multiple choice quizzes or tests, if you will. But not to worry, this isn't an actual quiz or a test today. This is just for us to find out a little bit more about you. As I said earlier, a question is going to come up and some multiple choice answers rather, and we encourage you to answer the question so we can learn about you more. Now we have just ideally a simple two-step process to get you on to the Kahoots today. For step one, if you could take your mobile phone, if you have a scanner with you, and scan the QR code that you see on the screen. Another option is to click the link that we are putting in the chat. Now, once you've scanned this QR code or clicked the link, you should get a prompt to enter your name and then press OK. And just to note, if you press the link in the Zoom chat, a new window should appear, so do not be worried if you get away from the Zoom for a moment. We're going to let it be for a minute or two while you all come onto the Zoom. And if you run into technical difficulties, let us know via the Q&A function at the bottom of the screen. We will, if we can, support you to try to get onto this Kahoot. And we'll just give ourselves one more minute to try and get as many folks onto the Kahoot as possible. Now it may be helpful to now switch over to the Kahoot screen on PowerPoint. Perfect. I think we'll give it perhaps a second and then we can get started. So, welcome to our World Diabetes Day Kahoot number 1. We have 4 questions ahead for you. The first question is, which of the following best describes you? Select all that apply. Red, person living with diabetes. Yellow, healthcare professional. Light blue, policymaker. Dark blue, caregiver for someone living with diabetes. Green, diabetes association. And purple, other. We have 15 seconds left to choose your answer. Now, for our answers, it looks like we have almost 20% of the room or our answerers living with diabetes, 70% healthcare professional, 4% policymaker, almost 20% caregiver for someone living with diabetes, 10% diabetes association, and almost 20% other. For our second question, we ask, which region are you from? Red, African region. Yellow, Southeast Asia region. Light blue, Eastern Mediterranean region. Dark blue, region of the Americas. Green, European region. And finally, purple, Western Pacific region. And there are 15 seconds remaining to choose your answer. Great. Now it looks like we actually have a fairly even split across the African region, Southeast Asia region, and region of the Americas, and then about 10% in the Eastern Mediterranean, 13% in European, and 3% in the Western Pacific. Now, our third question for you is, what does well-being mean to you? And for this particular question, you can type your answer. We ask that you try to keep it to 3 words maximum. Thank you all for trying to submit your answers. I know that this particular question requires a little bit more thought perhaps than the other ones. We have 10 seconds left, so please do submit your 3-word maximum answer if you can. Incredible. It looks like we have a lot of answers that say living healthy, and many answers actually that relate to health or being healthy. We have healthy up there, health, good health, being healthy. And it also looks like we have some related to quality of life and happiness. And some of our smaller ones include mindfulness, normal range, which I'm sure refers to blood sugar levels, and peace. Thank you for submitting your answers. Now for our final and fourth question, we have the question, which factor has been the biggest impact on your well-being? Red, daily diabetes management. Yellow, access to support from a healthcare professional. Blue, access to medicines and supplies. And finally, green, stigma and discrimination. And we have 15 seconds remaining. It looks like we have a quite even split between daily diabetes management and access to support from a healthcare professional. And then additionally, access to medicines and supplies. And finally, stigma and discrimination. We have a lot of work to do in all 4 of these areas, I think. Diabetes well-being, of course, is impacted by so many aspects of our life, some that we have power over and others that we don't have power over. And so we have to, I suppose it's about finding a good balance of information and support and resources and a network to help us come to find our own personal balance of well-being. And I'll hand it over now to you, Phil.
Thank you very much. Thank you again, Aurea, and thank you everybody for participating in our first Kahoot. There will be another later on, and we'll come to that soon enough. So let's return then to the theme of World Diabetes Day, which has been teased up by the video that we played and by our president, Dr. Peter Schwartz. And this year we aim to highlight the often hidden impact of diabetes on people's well-being. This doesn't get enough attention, it really doesn't. So we want to draw attention to the lack of support for emotional well-being. I mean, if you're living with diabetes, reflect. How often have you been asked about how you feel rather than how your blood sugars are doing or being told what you should do better? So let's draw attention to that, and let's also demand that greater attention is given to help filling that gap. Go to the next slide. Thank you. Peter drew on some of these results, but we surveyed close to 2,000 people living with diabetes in 7 different countries across our 7 regions. Over 3 in 4 confirmed a negative impact on their emotional well-being, with in fact 77% saying they had experienced anxiety, depression, or another mental health condition because of their diabetes. So this is a serious but much hidden issue. The fear of developing complications was one of the most common factors impacting mental health. 83% of respondents mentioned that. And other factors included the kind of effort required for daily diabetes management, 76%, stigma and discrimination, 58%, and even the fear of needles, 55%. Go to the next, please. Many, some 80% of respondents said they had experienced diabetes burnout. This is caused by exhaustion and feeling of being overwhelmed by the ongoing daily effort. Psychological symptoms include feeling that diabetes is in control of your life, brings on feelings of negativity and a lack of motivation to follow treatment plans. In fact, next slide, please. this is highly significant because 75% of respondents who said they had experienced burnout also said that they had neglected their self-care by interrupting their treatment. Clearly a concern. And next slide, please. There's a clear desire for more to be done. We need more support from healthcare providers in this area. 75% of our respondents want more to be done. Next slide, please. So what can you do? Well, please visit the World Diabetes Day website, take a look at the call to action, have a look at the resources. You can send a letter to ask governments to support and implement the WHO Diabetes Compact. So surf to the World Diabetes Day website and join our call to action after this webinar. To the next slide, please. Thank you very much. The website has all kinds of resources, gives you the opportunity to participate. So if you have an event, no matter how small, if it's just you on your own, doesn't matter. Take a selfie, take a photo of the event, add your action to the resources available. Mark your activity on our interactive map. Aurea, turn back to you now to introduce our next speaker. Thank you.
Thank you so much, Phil. I think it's shocking actually to hear some of those numbers, the 80% or the almost 80% of respondents having experienced diabetes burnout. It goes to show how much more there is to do, and I think I actually also feel seen there. I know that I've experienced diabetes burnout myself, and although the numbers, they're appalling and they show the gap of the work that we need to do, I think there's also a lot of value in knowing that a lot of people have experienced different challenges, and there's a lot of value to connecting with other people living with diabetes to learn from them and to feel understood. I also want to quickly reiterate, please do join our call to action to policymakers. Individually, of course, we are powerful, but together we are much more powerful. You all have the power individually to go follow that link, to join our call to action. Do help us try to see through our vision of both reducing the risk of diabetes and also making sure that everyone diagnosed with diabetes has access to equitable, comprehensive, affordable, and quality treatment and care. Now, without further ado, it is my absolute pleasure to welcome our next speaker, Dr. Guy Phones. Thank you so much for taking a little bit of time out of your very busy schedule, I know, to come speak with us in person today. Over to you, the floor is yours.
Thank you so much, Aurea. Thanks, Phil. And please, there is no busy agenda. This is such an important discussion. It's an honor and pleasure to join you and the hundreds of participants who've dialed in. Such a great discussion so far. I'm excited to come at this stage of the discussion where I can build on the amazing calls to actions we've heard from, certainly from Osarenko, but also from Phil, from Peter, the president of International Diabetes Federation. Really the overall call to action that was just then translated. It was impressive to see how that was translated into the Kahoot responses, really calling for everyone's attention on better quality of life and well-being for those living with and affected by diabetes. I hope in my slides I can provide some clear overview of how we, WHO, are absolutely committed and already walking the talk on those calls to action through the WHO Global Diabetes Compact. Thank you. Our journey certainly did not start here, but there was a clear milestone, a game-changing moment in 2022, as was mentioned already, when the World Health Assembly, the leading global health decision-making body, decided and adopted on the global diabetes coverage targets. Very clear roadmap, ambitious but feasible targets to address the quality of life and well-being of those living with diabetes. And that called to ensure that by 2030, 80% of people with diabetes are diagnosed. 80% of people with diagnosed diabetes have good control of glycemia. 80% of people with diagnosed diabetes also have good control of blood pressure. 60% of people with diabetes of 40 years or older receive statins. And importantly, 100% of people with type 1 diabetes have access to affordable insulin treatment and blood glucose self-monitoring. ambitious targets. If you go to the next slide, please. WHO stepped up, said this is feasible, this is ambitious, this is absolutely necessary. These gaps must be filled, and we have a short timeline to deliver and support our member states' deliverance and ensure those living with diabetes have the opportunity that we are committed to. So we launched the Global Diabetes Compact. It was launched in April of 2021 in line with the decision that was being adopted in governing bodies at WHO. And very importantly, it coincided, and it was not a coincidence, but it was intentionally launched at the 100th anniversary of the discovery of insulin, both demonstrating the opportunity, the celebrating the discovery of this life-saving medication, but also identifying the challenges and the unacceptable pain that the huge gaps in access, affordability, availability of insulin still impact and undermine those living with and affected by insulin. So, and it was very much importantly to note, hosted and led by heads of state, Government of Canada, and heads of state, ministers of health, and other high-level non-state actors, really demonstrating the high-level political leadership, commitment, and power to launch this important compact. Next slide. And the compact, how do we operationalize? How do we, WHO, ensure that we do support our member states and we are drawing attention to those important targets? And the framework, the operational framework of the Global Diabetes Compact is divided to 6 very, very important priorities, work streams. The first on access to essential diabetes medicines and associated health technologies. A second important one on developing additional technical products that can ensure some of the guidance, frameworks, and monitoring of diabetes agenda. Workstream 3 on prevention, health promotion, health literacy. The fourth is on country support, identifying enhancing our ability and our tools and processes to support countries. Workstream 5 on enhancing the research and innovation around some of the gaps and pain points. And the last 6, very important, on the governance. And I'll dig a little deeper into that one, very important. But I invite you, there's so much happening in each of these work streams, so much great progress, launches, developments, and I encourage you to visit our sites and our resources and get a better understanding of the amazing opportunities there and how we can further enhance all of these work streams with your participation and insights. But if we go to the work stream 6, which is so important on governance, you go to the next slide, Ori, please. And it governance around co-designing, co-developing responses for the NCD epidemic absolutely requires, and it must be substantiated and founded on the engagement, meaningful engagement of those living with and affected by diabetes, and how they need to be brought in as experts in enhancing some of the solutions we are developing, identifying the key areas, the contextual needs on the ground that will make a difference in how we shape some of these policies, programs, and services. So intentionally, the Global Diabetes Compact does have a very, very conscious and active work stream on the meaningful engagement of people living with diabetes. And this engagement has already identified and shaped many of our processes through, for example, mainly through annual focus groups and consultations, which have already informed language surveys, for example, on people with lived experience of diabetes. It also informed a wider WHO effort on developing a framework, WHO framework for the meaningful engagement of people living with NCDs and mental health conditions, which was informed by the expertise, in particular, of those individuals living with diabetes, among many other health conditions, but very, very active engagement from the community of lived experience of diabetes. And that the importance of that framework, which is also informed much of our work across those 6 work streams, are those principles, ensuring the respect and the implementation and attention to the key principles and enablers that have been defined in the framework. Just to name a few, very important for our discussions have been the redistribution of power towards individuals with lived experience and understanding the lived experience and expertise that should shape policies and programs. And also understanding inclusivity and institutionalization, of meaningful engagement across all of our processes. So just demonstrating WHO is walking the talk and is implementing these principles and enables across all of our activities. Next slide, please. And my last call, and I've touched on that, please get involved with more depth and with more frequency across all of our opportunities. The entry points are certainly the engagement of lived experience to the GDC, and also the GDC, the Global Diabetes Compact Forum, which has a biannual engagement with non-state actors, including lived experience, also getting informed via the newsletters, but also identifying other opportunities through our website and through our focal points on additional areas across those pillars that need your support, your insights, to ensure enhanced quality of life and well-being for all those living with and affected by diabetes. Thanks so much for the opportunity, Oria, Phil, and back to you.
Thank you very much for that. Okay, so we're going to have our second Kahoot session now. I know you're all familiar with this now. You know the drill. So please go ahead and scan this QR code if you're going to participate on your mobile, or click on the link in the chat. Enter your name and click OK. Thank you. Let's move on to the screen. Okay. Thank you, all those who are joining. See those avatars arriving. When we get to 250 participants, we'll move on. Okay, we're over 230 now, so I think we can move forward. Okay, so some questions for you to answer. So does diabetes care in your country include enough support for well-being? It's red a yes, that's blue a no, or the yellow orange color, I don't know. Okay, we're ticking down with 25 or so seconds left before we see the results. Looks like everyone's answered. So just bear with us. Just count this last section of time down. Oh, some people coming in at the last minute. Thank you. Okay. Okay, so see that there's a sort of overwhelming response of no, a level of uncertainty. I think if we put those together, we can see that more needs to be done. And I think an interesting result that quite a lot of people, so about a third, approaching a third of respondents, felt that there was enough. So it'll be very interesting to see which countries are providing enough care, could help us target some of our advocacy work. Thank you. Let's go on. So next question, is your government dedicating enough resources to support the well-being of people living with diabetes? About 30 seconds left to respond. I think that most of the respondents are Responses are in, so bear with us. Count down the last 15 seconds here. Very good. Here we go. Okay, so overwhelmingly, we feel a feeling in the room that there is not sufficient resource in the majority of places, and then a group as well that feel that there is. So again, I'll be very interested to see the geographic split on that. Thank you. Let's move on. Okay, so your final question. What is the most important action needed to improve well-being for people living with diabetes in your country? Is it, in the red, improve access to affordable medicines and supplies? Is it in the blue, provide training on well-being for healthcare professionals? Is it the yellow, reduce stigma and discrimination? Or do you feel it's something else, green, other? I believe we've had some issues for some of you with the audio on the interpretation, so apologies for that. We're busy in the background trying to improve that sound quality. Now we're counting down to the last seconds now. And let's see the results. So it's the access issue that remains primary. Access to the affordable medicines, access to the supplies, very important. Training on well-being, coming in second place here. Stigma, less of a concern for many, and a fair number of people have other concerns. Be interesting to tease those out at some point. So thank you, everybody, for participating in that and sharing your insights from your own contexts. Thank you. Okay, I think, Aurea, you're going to introduce our important panel discussion.
Yes, indeed. That is exactly what I'm going to do. I just wanted to also share a quick thank you to everybody who has played our Kahoots. Admittedly, we were unsure if they were going to be able to proceed as planned, and for the almost 300 of you that were able to participate today, thank you very much. It was really cool to use this platform and to see those responses come through. The number of no's that we got in that past Kahoot, I think, highlights some gaps, some areas for us to work on. And now, without further ado, for the next 25 minutes or so of this webinar, I am pleased to be starting the panel discussion section. We have 4 panelists joining us today, all from different locations around the world and all with different lived experiences of diabetes. We're going to start off with some quick introductions from all of our panelists, and then we're going to move into a Q&A session. Now, to our attendees in the audience, I highly encourage you to use the Q&A button below to submit the questions that you have related to diabetes and well-being for our panelists. Now, panelists, if you could kindly give a brief introduction of yourself, your name, what you do, your connection to diabetes. And Danny, you can go ahead and start, and then you can be followed by Jackie and Nick and Arum. Over to you, Danny.
Thank you. It's such a pleasure to be here today with all of you. My name is Dani Rojas. I am born and raised in Costa Rica. I am a psychologist who specializes in work with people living with diabetes, also a diabetes educator, and an advocate for access to mental health in the Latin American region. as well as the co-author of, co-creator of Vasoterapia Diabetes, a tool for creating meaningful conversations around life with diabetes and mental health. I'm extremely happy to be here today.
Hello,
Thank you
everyone.
much,
I'm Jackie.
Jenny. Sorry, Jackie, please do go ahead.
It's okay. So I'm Jackie Malouf from Beirut, Lebanon. I am the founder and president of Dialab, the National Diabetes Organization in Lebanon, which is a leading awareness organization and patient association for the last 15 years. And I'm happy to be here today wearing also my hat as vice president as the International Diabetes Federation. I am the mother of a daughter living with type 1 diabetes for the last 17 years now. And well, through my different hats, I carry the mission, which I like to say that it is my mission in life to advocate for those living with diabetes around the globe. Thank you. Very happy to be here.
My name is Nick Loughton. I'm born and raised on the west coast of Canada, a small town called Victoria. I've been living with type 1 diabetes for the last 25 years. And as a person with that lived experience, I've worn many hats. I've been a diabetes advocate. I have fundraised on behalf of organizations locally and nationally that do research and raise awareness and do advocacy for type 1 diabetes. And I've also been a researcher. In a past life, I spent a number of years researching in a lab at the University of Calgary and trying to find therapeutic treatments that can help aid people who live with diabetes. Thanks.
Hello, everyone. I'm Iram Ghafoor from Pakistan, and I am the president of National Association of Diabetes Educators right now. And basically, I am a certified diabetes educator, one of the pioneer educators of my country, and a healthcare professional as I'm working with the public health sector as well. So I'm working with the WHO as a consultant for therapeutic patient education. And it's been a long time that I'm associated with the IDF. And I am the first Blue Circle Voice of Pakistan. But on top of everything, I am the person with diabetes, and I was diagnosed at age of 14. And I must say that diabetes is a blessing for me because it has given me opportunity to connect with a lot of people around the world and make me to help them and feel their all the needs and pain. So I'm so glad to be here, and I'm really thankful to WHO and IDF for inviting me in this webinar.
Thank you so much, Arum, and to all 4 of our panelists. We are now going to be moving on to the question and answer session. And if I could kindly ask you to try and keep your responses to 2 minutes or less, that will help us move through as many questions as we can.
Okay, I'll present the first question then, and this is for you, Daniela. How can we better support the mental health needs of people living with diabetes, considering the chronic and often unpredictable nature of the condition?
Thank you so much, Phil. I think that the beginning is just to understand how complex it is, the interplay between living with a condition that has such a big emotional part alongside the physical health of a person. And it requires to be understood as such. For a very long time, we've been focused merely or specifically very hard on the physical factor. And a lot of the times the mental health, that's very well explained throughout the videos and the chats today, have been left aside. And subject topics such as stigma, such as being misunderstood, the mere factor of not understanding the value to proper access to medicine in order to be able to live with this, and the toll that this may have financially, emotionally on a person living with diabetes. So one of the first things, and I have to say, I'm extremely pleased to see there are so many healthcare professionals here today, is working hand in hand, because a lot of the times throughout the time, we have been working specifically with the people living with diabetes, which is wonderful. But a lot of the times we forget that this is an interplay, that we need to work together. And a lot of the times, the fact that we're not doing that and helping to healthcare professionals to better understand how to address the mental health factors put us as all at risk as people living with diabetes. So I would very much encourage the fact that as long as we start working together as a team, understanding that the more healthcare professionals are aware of signs of depression, anxiety, suicidal thoughts, the fact that they know how to do it, because we need to be aware that it is, as also as showing in the Kahoots, the difference in regions is massive. So but the more that we start teaching and learning can make us all more safe. And the fact of also providing security for people to feel safe or asking help, which is another big thing. A lot of the times people feel embarrassed or shocked or might be nervous about speaking out about their needs. So it's a matter of really understanding that there is no possible health without having mental health, which is often unseen, untaken care of. So it's basically understanding that we need both mental health in order to have physical health, and understanding all of the factors that actually demand of a person living with diabetes, and not solely them, but also their family members, also those around them who love them, and the very much need of us to work harder to educate the community outside the diabetes community on subjects such as stigma and actual diabetes education to help prevent stigma around our community.
Thank you for that answer. That teamwork component is key in coming through. Of course, we know that depression is higher among people living with diabetes than the general public. We know that it's higher suicidal thoughts and attempts, and even sadly suicides are higher among people living with diabetes. And with the condition changing over time, that the challenges keep coming. So thank you so much for that response. Aurea, I think you're going to take the next question.
Yes, I will be. Thank you, Danny, for your response. I love that phrase, there's no health without mental health. I think sometimes we forget, of course, that health is all encompassing. There's physical health, but there's also mental health, and there's also social health, and making sure that we loop in our healthcare providers that are sometimes more focused on physical health to also make sure that they're well informed and have resources to care for mental health. I mean, it's instrumental in these conversations that we're having about diabetes and well-being and how to promote well-being in the long term. Thank you. Now, my next question is for you, Jackie. And the question is, how can non-governmental organizations and support networks contribute to improving the well-being and quality of life for people living with diabetes? And why is universal healthcare essential in this effort? Please go ahead.
Thank you. Well, I will start by saying that health back in the time used to be defined as the absence of diseases, where nowadays it means the well-being and the quality of life that people are living. And today we're talking about people living with diabetes. So it is of utmost importance to shed the light on the role of NGOs, especially that they are the ones taking care of the well-being, the part at least that has to do with all what we've heard about the burnout, the stigma, the feeling tired, feeling alone, and so on. So as we thrive to achieve the high quality and sustainable care, and at the same time, the universal health coverage, it is really essential to acknowledge the important role of the NGOs, not only in making it heard, but in amplifying the voices of those people living with diabetes. So we can say that NGOs play a pivotal role in bridging the gap between communities on one hand and the healthcare resources on another hand, empowering through that individual to access diabetes care and to alleviate the burdens. And we've heard that there are so many burdens and very heavy ones indeed associated with this lifelong condition. So we don't have to forget that it is a lifelong condition. They have to live for it for the rest of their days, unless we never lose hope. We hope for a cure. So this focus that NGOs have on advocacy and support, it brings us somehow closer to achieving a better quality of life and overall well-being. And through the support groups, and I've seen that someone in the chat had asked before about the support groups and the peer network, and this is a specialty of NGOs more than anything else. So that creates a vital space, and it is a safe space indeed, where they can foster emotional and psychological support alongside with the physical care. So peer support in particular is an invaluable resource, as it helps people living with diabetes feel understood and supported by others who share similar experience. So here comes the phrase, "I'm not alone." And I've seen it firsthand when we do the support groups at Dialab, the way they come in feeling shy, feeling I don't know what to expect. And when they come out with this boost of resilience, of self-esteem, of sense of community that really provides further than knowledge, it enhances their resilience, making them feel stronger than ever and more empowered in managing their condition. I'll be brief, but the access to universal healthcare remains really a fundamental challenge, and it has many barriers, especially in those areas affected by socio-political conflict and wars. And coming from Lebanon, I'm sure you all understand why I'm pointing out to this very important details, because in those areas, really, sometimes health becomes as a secondary item. People don't have time to think about their health. So despite health being a basic human right for countless individuals, especially those living in those areas I'm talking about, it's really unacceptable how they lack healthcare. Let me say one final thing about this. As a mother of a young lady living with type 1,
Sorry, Jackie. Looks like we've lost you for a moment there.
Okay, well, Jackie's comments there were pretty important on the strength and the power of national diabetes associations and local organizations. So I would encourage everybody to avail themselves of the facility, the resources that are available to try to connect with those peer-to-peer networks within the organizations. Okay, I think I better move the conversation on then. So Nick, I have a question for you here. Nick, how does living with diabetes affect your mental health and cognitive function, if you don't mind sharing?
Yeah, thanks for the question, Phil. And I think just to reiterate partly in what Jackie was actually just picking up on about that lived experience piece and having diabetes. Really the thing that diabetes presents as the most difficult challenge for me in my experience is that extra mental load. And one of the most important ways that you can combat that, and I think this is exactly where Jackie was going with it, is peer support. Surrounding yourself with folks who are going to give you support when you need it, who you can lean on, and who you can talk to about how you're feeling, and who will understand you because they either have the same lived experience or they know someone who has the same lived experience. It's got a really key impact on mental health in particular, as Danny sort of alluded to earlier. When you're sort of under that extra pressure in any other kind of facet of your life, For me, it'll be if I'm preparing for a trial, if I'm working on a particularly high pressure project or situation. It's just that one extra thing that's liable to push you over the edge. It's going to cause an extra little spike in your anxiety, or it's going to get you extra feeling down on a day, or if your sugars are out of whack, it's going to really put you in a bit of a more frustrated or impatient kind of position. And that's just going to affect your ability to carry on both your regular daily tasks and to stay regulated in the short and long term. It's really important then to fight those feelings of hopelessness, depression, and especially on those days when nothing is going right, by having that support and being able to find that connection and reach out. So connecting with those other organizations and locals who feel you and understand you and can communicate with you on that same level is so important. It's so critical. And so I hope that everyone that's here today can reach out to a local organization or can find someone in their lives who understands where they're coming from and can provide that same kind of support. Thank you.
Thank you. Thank you very, very much, Nick. That constant noise that you can't switch off, that nagging itch that you can't reach, that overwhelming feeling sometimes of anxiety when diabetes as well as the other pressures become too much. Thank you for sharing that with us. Aurea, back to you, please.
Yes, thank you very much, Nick. Your response, as well as Jackie's response, actually has me reflecting a little bit on my time at diabetes camp as a child. I was incredibly fortunate to attend a camp right after my diagnosis, and I cried so hard on the very first day because I had been feeling an intense sense of isolation, and I was drowning in that isolation. And the first time I met was a cabin full of other young girls living with diabetes. The relief off my shoulders, even outside of resources and outside of education, I felt so loved and so understood. And we can't, we really should highlight, I think, the value of that peer support, that being understood. Now I have a question next for a room, and I just wanted to say to panelists, we don't have too much time left, but we have a ton of interesting questions queued. If you could try your best to be quite brief in your responses, and we will get through as many questions as we can in about the next 5 to 10 minutes. So a room for you, our question is, how does the stigmatization of diabetes in academic settings create barriers to equal opportunities? And what can be done to foster inclusivity? Thank you.
Thank you, Aurea. That is a very nice question. And actually, I always says that being educated doesn't mean you are being aware as well. So if the person is educated, that doesn't mean they are aware with the consequences, with the diagnosis, with everything, the trauma, the burnout, the everything. So most of the time, I myself has faced it, and most of the time I get some patients, especially the children, who get stigmatized or discriminated at schools, and they don't teacher because the teacher doesn't know anything about diabetes. There is no concept of giving them opportunity to check their blood glucose levels, special rooms for them so they can take insulin on time. And if I would relate this question with myself, then I still remember then when I wanted to become a diabetes educator. And I'm not going to mention the name of the university and the person, but at that time, my admission got rejected because I am a person with diabetes. And the reason have been told to me that since you are a person with diabetes, so you are unable to study that hard. And my whole year was wasted at that time. So this is, and I'm not blaming anyone actually, The reason behind is that people should know all these things at academic institutions, schools, colleges. They must have knowledge. So this misconception will not play any negative role in lives of students, because as a result, these children, these students go in social isolation, their mental health get compromised, and the acceptability of them in community is also get compromised. And what I think we should do, the
Thank you,
first
everyone.
thing.
We've reached the 2-minute mark, by the way.
Okay, I'm just going to complete it in 1 2 sentences. That actually we need to initiate the education and awareness campaigns and some policy and procedural changes, and incorporate all those changes as in shape of peer support network, and of course they provide opportunities to all the people who are working in the community for the training, for the education, and for the awareness.
Thank you
This is what
very
I can
much.
give to tell. Thank you.
Thank you very much, and welcome back, Jackie. I'm sorry we lost you for a while there. We're getting some questions coming in from our audience, so go quickly and look for quite brief answers, please. This question is for you, Daniela. This is saying that this is coming from quite a lot of our audience members, that systems don't seem to worry about how a person feels either during the period of diagnosis or afterwards. How can we get healthcare professionals to understand that this is something we need to address? It's not just about medication. For you, Daniela.
Okay, thank you. And thank you for that wonderful question. I think that most of the time that's referring to what I was saying before. It's the fact that we always say, and I love this about these meetings, we always say, let's bridge the gap. And I've been thinking about this for a decade. And I think people can bridge gaps by talking. And a lot of the time it's difficult to talk and to find a spot. Everyone's very busy, or sometimes your country won't allow it, or your social services are hard to get. But if we can start inviting people to the conversation, or you mentioned camps. For instance, if we can invite them for camps and actually let them understand what truly life with diabetes looks like. And this applies to every kind of diabetes, because I have to say, oftentimes type 1 diabetes camps are much more popular than type 2 diabetes camps, but this doesn't mean that people with type 2 diabetes do not need, and other types of diabetes need the same things that people living with type 1 diabetes require. So one of the biggest things is to bring them in. A lot of the times we feel this bridge puts us in different teams as if we were competing against each other. And I think bridging the gap starts with a conversation, allowing them to understand the physical and mental toll, like Nick was saying alongside Jackie, that it requires to actually simply play a game and be checking your blood sugars all the time, waking up 3 or 4 times because you jog too much throughout your day and you have a difficult morning the next day. Allowing them to see it with their own eyes can really help bridge this gap. Also teaching them about basic screenings, how they can actually do this, because a lot of the times we also forget that they can be also scared because they don't know what to do. So presenting them with screenings that are very easy to do, allowing them to have questions, helping them work alongside mental health providers, and allowing them to be part of associations and letting them understand that instead of being opponents, we are part of this community, will allow them to actually make decisions alongside those who live with diabetes. And that's where we can start doing nothing without it, but with us. And this is very important. So I would say that instead of maybe feeling we're on opposite ends, maybe we start thinking about how we can blend together, start a conversation, let them understand what it's needed, and see what we can work together in both helping each other to make this work.
Thank you so much, Danny. I like the sentiment that you're sharing. It's not us versus them, is it? It's us all together against the challenge that we're facing.
Okay, the questions coming in. There's one for Jackie. this, this this person asked, what can people from other countries do to help people with diabetes in war zones so they continue to access the care and medicines they need to ensure their well-being?
Thank you for this question, and apologies because my internet went down. I was with the last sentence where I was saying passionately that I cannot believe that 100 years after the discovery of insulin, it remains unavailable and unaffordable for many people living with diabetes. And I do look forward for the day where we should achieve the goal of making it available and affordable for everybody. I really wanted to say this sentence. Now, regarding how you can help people in war zone, there are many, many scenarios. And sometimes, unfortunately, politics play a role in letting or not letting the help and the needed medication get to the people. In the case of Lebanon, where I live and where I'm aware of what's going on, we have many displaced people. They are living in schools now. Our volunteers, our team, they are on the ground visiting those schools, trying to do glucose testing, trying to see who has diabetes, who did not have the chance to pick up devices or their insulin, what they are lacking, providing nutrition consultation, providing medical consultation as we team with universities, with medical universities. And we are on the ground for safety of volunteers. We are avoiding the transportation from one area to the other. So we are using local volunteers. And how people can help: donating medication. In some cases, it cannot be that easy, as only the Ministry of Health can receive those types of donations. And we do know that insulin requires a cold chain, which is not easy to handle. But also donations can support the people on the ground because the availability is still there. We do have available medication, but it's not affordable or accessible to those displaced people. So donations in some cases also can help, but mainly being on the ground. And that's why I like to call the people from NGOs, local NGOs, particularly with respect of the global and international ones who are much bigger, have more resources. We, the small local NGOs, we know our people. We know how to approach them. We know how to talk to them. We know the language. We know the culture. So if we team together with the global organization. And that's why this webinar is so beautiful. This World Diabetes Day here that showcases this great collaboration between those big organizations that I'm proud to belong to one of them. This is great because that's the only way to help people living in war zones and in conflict. And I keep saying this, we talk about readiness. I believe we will never be ready for another war. We will never be ready for another disaster. And believe me when I say this being a Lebanese person, we've had really one disaster after the other since 2019. And we keep having more. I don't know where it's going to stop. Yes, it has made us resilient, but we want it to stop. We want to stop being resilient. We want to be normal people. We want to live a normal life. And this is what I hear from people living with diabetes. They have enough to handle with so many decisions, daily decisions regarding diabetes, to think about their safety, to think about where they're going to be displaced. This is a big topic. I'm sorry I got carried away.
Thank you,
I don't want to take time from other people, but this is a very important question. And thank you for even thinking to help people living with diabetes in war zones. Thank you.
Thank you, Jackie. Thank you for the passion and everything you do in the field. We're really up against time, so I think it's a kind of quick question to everyone with 20 seconds to answer and no more. So Jackie, as you're on screen at the moment, let's start with you. Question is, in 20 seconds or less, what would be your call to action to improve diabetes well-being?
Well, to continue with what I was saying, my call to action would be for governments and policymakers to empower, to support local NGOs so they do the roles, because they are the frontliners, and we do need this empowerment. We do need the support. We need to work hand in hand, and we need to have this push forward, not barriers. we are used to barriers, but we need to have the push forward. So let us all commit to bridging these gaps and unite forces to ensure health equity and health literacy, which is very important in order to ensure the well-being of people living with diabetes.
Thank you so much, Jackie. Erum, can we go to you with that same question? Is that okay? What would be your call to action in 20 seconds or less? Sorry to concertina people into such a narrow space here. Erum, you need to come off of mute, please.
Thank you, and I will try my best to remain in 20 seconds. So I think the call of action, the first thing we should do, that we should educate the public, provide self-management education as much as we can, and improve the access to care, increase awareness, and encourage early reduction. And most important, build peer support networks. So that's how we can improve. And this should be the call of action for being for well-being for people with diabetes.
Thank you very much, Nick. Can we have your call to action in 20 seconds or less, please?
Yeah, this goes out to everyone with diabetes on the call is, you know, find your community. And if it doesn't exist where you are, make one. Be that change. You know, you can show up. And if you have a health center or somewhere like that where everyone is going to be congregating at one point or another, that's a great place to advertise. But you be that change. You go out and make that happen.
Thank you very much, Daniela. Yours?
Well, I have to say I resonate with all of them, and I would say it's a mix between Erum's and Jackie's, alongside with Nick, is come together, allow people with diabetes to have a voice that matters as much of those in the policymaking group, and allow people to just listen and to invite associations and organizations to be part of the decision making in order to make well-being and mental health a priority of people living not only with diabetes, but every chronic condition around the world.
Thank you very much. Before I hand over to Aurea to wrap things up, let me just say that we will follow up with a survey. So please provide your feedback. Thank you everyone for your comments on the panel. If any policymakers are tuned in, you now have your to-do list. So get on with it. Thank you. Aurea.
Thank you very much, Phil, and thank you to Danny, Erum, Nick, and Jackie. It has been such a pleasure to hear from you, to hear your insights, your suggestions, and your thoughts on our questions today. I do apologize. This panel session seems to have gone by genuinely in 2 minutes, and there were a lot of questions that we weren't able to ask. But hopefully this just means that there's more opportunities in the coming months and perhaps for next year to continue these really important discussions about diabetes and well-being. I know that we're a couple minutes over, but I want to extend a deep, genuine thank you from the bottom of my heart for having joined us today, for taking a bit of time out of your day to have a conversation with us about diabetes and about well-being. I want to thank my co-moderator, Phil, for moderating with me today, our amazing teams at the International Diabetes Federation and the World Health Organization for supporting behind the scenes for weeks to pull this webinar together. And thank you to every single person that was able to join this webinar to come and learn a little bit about diabetes and well-being. I wish you a meaningful Diabetes Awareness Month. I wish you an early, happy World Diabetes Day tomorrow. Thank you again, and I hope you have a wonderful rest of day. Please do keep in touch, and I hope to see you all soon. Goodbye, everybody. Thank you.
Thank you.
Thanks, folks.
Thank you. Bye.